So welcome everyone. We are so glad that you're joining us today for FIG's webinar, Plan, Reflect, and Adapt to discuss tools to strengthen accreditation readiness. This is an interactive session designed to help you approach accreditation, quality improvement, and performance management work with more clarity, structure, and momentum. Today's webinar is especially relevant for local, tribal, state, and territorial health department staff, accreditation coordinators and quality improvement leads, public health professionals working on strategic planning, workforce development, or performance management, agencies pursuing or considering pathways recognition, initial accreditation, or reaccreditation, and anyone looking for low barrier tools that apply QI and project management principles in a meaningful way. So whether you're just beginning your accreditation or QI journey or already deep in the process, we plan for you to leave today's session with practical tools and strategies to strengthen your internal capacity and move your work forward. Before we dive in, we're going to quickly go over a few logistics for today's webinar. So all participants were automatically muted by the webinar administrator to minimize background noise and help things run smoothly today. We ask you to please use the Q&A feature at the bottom of your screen to submit questions at any time. We'll be monitoring it throughout, and we'll leave time at the end to respond to these questions. This session is being recorded and will be posted on PHAB's website, so you can revisit the content or share it with a colleague who wasn't able to attend today. We also want to remind you that Zoom does have real-time text display as closed captions that can be toggled on or off by pressing the CC or Show Captions button at the bottom of your Zoom toolbar. And next, we're going to take a quick moment to introduce ourselves. So my name is Amanda Marino, and I'm the education specialist working on the Public Health Systems and Services team and Education Services team here at PHAB. My role involves developing and implementing educational resources, training, and technical assistance to support health departments through their accreditation or recognition journey. I'll be co-facilitating this session today with Leah, so I will pass it over to her to introduce herself.
Awesome. Hi, all. My name is Leah Moser. I'm a senior specialist on our Public Health Systems and Services team. And as part of my work with PHAB, I also help health departments across the country with tools, resources, training, and technical assistance to help strengthen their quality improvement and accreditation efforts. And I am located in Kansas City, Missouri.
Thanks, Leah. Oh, I forgot to mention where I was located. I am located in southern New Jersey, not too far from the Atlantic City area. All right, so next, we wanted to give a quick introduction for those who may be new to PHAB. So PHAB is a nonprofit public health organization that serves as the accrediting body for public health in the United States. As you know, health departments are the backbone of this ecosystem, delivering essential services and providing meaningful impact in the communities they serve. PHAB promotes the use of evidence and forward-thinking approaches to strengthen infrastructure, improve performance, and support both health departments and their partners in delivering high-quality programs and services. So before we dive into today's content, we want to ground ourselves in the bigger picture. Pursuing accreditation or quality improvement is not just about checking a box. It's about strengthening your internal systems so your department can grow and adapt and serve your community most effectively. That means planning with intention, reflecting on what's working, and adapting when things need to shift, whether that's staffing, funding, or community needs. Still, we know that doing this work can feel overwhelming. Strategic plans get outdated, workforce development gets pushed to the side, and accreditation efforts can get scattered across departments and people and documents. It happens. So today's session is designed to help with these things. We'll focus on 3 common challenges that departments face and walk through tools that can bring structure, clarity, and momentum to your QI and accreditation work. So now that we covered the bigger picture, here's what we'll dive deeper into today. We've structured the session around 3 common challenges that we hear from departments, and they are outdated or unused strategic plans, lack of a consistent approach to workforce development, scattered or uncoordinated accreditation efforts. So those are the three. And for each challenge, we'll walk through a realistic scenario, introduce a PHAB tool that can help, and then connect it to quality improvement and performance management principles. We'll also highlight a few additional tools and then wrap up with time for reflection and Q&A so you can leave with practical ideas and next steps to take back to your team. All right, so we're going to dive into our first challenge. So we're calling this the strategic fog. So you probably know this scenario. The strategic plan technically exists, but it's sitting in a binder on a shelf, or maybe it's buried in someone's inbox. It really isn't guiding day-to-day decisions, and most staff either don't know what it says or aren't really sure how it connects to their work. So think about if your plan is something you regularly use and update, or if it's more of a set it and forget it document. So we're going to launch a poll now to discuss. So as soon as it pops up, please take a moment to respond. All right, see those responses coming in. Thank you. And the question is, how often do you revisit your department's strategic plan? At least quarterly, once or twice a year, only during accreditation or annual reporting. We have a plan, but don't actively revisit it. And we don't currently have a strategic plan. Give another couple of seconds. All right. So we have a mix of answers. So we have at least quarterly or once or twice a year at the top, only during accreditation or annual reporting being our least. And then the other two, we're a bit in the middle, having a plan but don't actively revisit it, or we don't currently have a strategic plan. So thank you for taking a moment to respond. So this is a common challenge with strategic planning, but it doesn't have to be the norm. I'm going to hand it over to Leah to discuss how to bring your strategic plan back to life and use it as a practical tool for intention, alignment, and ongoing improvement.
Awesome. Thanks, Amanda. So honestly, I am a bit surprised by those results, pleasantly surprised, I will say, because quarterly is, I would say, ideal to revisit, and even once or twice a year. I mean, at least it is being reviewed. So happy to hear that. I also want to talk about a template that we came out with in February of this year that can hopefully help you if you don't have a plan. I know there was about 12% that said that you don't have a plan, or sorry, 20% that said you don't have a plan. Or if you're just wanting to refresh your plan after a few years or after checking progress, then I think this template will be very, very helpful. So this template walks you through your mission, vision, priorities, goals, and measurable objectives, and helps you really build a realistic plan. It also is flexible enough for departments at any stage of the process and includes prompts for assigning roles, tracking progress, and reviewing your plan regularly so that it stays useful. It also reinforces a quality improvement mindset by helping you reflect, adapt, and connect your goals to daily work, and supports performance management by making it clear who is responsible, how success is measured, and when the plan will be revisited. So for those of you that aren't familiar with the plan, I wanted to do a quick walkthrough just so that you can see what the template looks like and become a bit more comfortable and familiar with it. So I'm going to go ahead and share my screen. So hopefully you should all be seeing the strategic plan template. There are a few, oops, is it still sharing?
Yes.
Yes, okay. I'm like, I lost it for a minute. So there are a few sections at the start that are optional, although I would recommend them just because I feel like they do a good job at giving some context and framing your strategic plan. I'm going to go over a few of the sections that I feel are most important to include and also aligned with PHAB requirements and what you would need to include if you were pursuing PHAB accreditation. So first we have your mission, vision, and values section. This section is really to help you figure out if you want to revisit your mission, vision, and values and edit them, go over them with your staff and figure out, okay, what do we have? What are we starting with? And where are some places that we might want to edit our mission, vision, and values? If you haven't revisited them in years, I think this is also a really good opportunity for you to revisit those and oops, I think I went to the wrong one, to revisit them and figure out if you want to fully do an overhaul and come up with new mission, vision, and values. Then we will move on to your strategic planning process section, which just goes over the assessments that you completed. Maybe you do a SWOT analysis or a SOAR analysis. And this is where you really summarize the process that you went through to create your strategic plan. Then you move on to your strategic priorities section. This is where you include the specific details of the strategic priorities that you decided on, your goals, objectives, and strategies. I will say that this section of the template is more high level. There is an action planning template in the appendices of the document that goes more in depth with, okay, who is doing what? It goes into depth with adding your specific activities that align with each strategies. And the reason we did that is because you probably will be updating your action plan more regularly than you will actually update this section of the plan. So hopefully that just helps it be a little bit more accessible to update. And then here we have your plan alignment section, which describes how your strategic plan aligns with your CHIP. You also might have some places where it aligns with your workforce development plan and also your performance management system. This is also a PHAB requirement, so I think it's a pretty important section to have. And one other thing to note is within the template, I did include example narratives where you can basically just copy and paste this section into your plan, but you would switch out the blue text with your specific health department information. And then we have the putting the plan into action section, which describes your KPIs for the plan, your key performance indicators. It describes who is in charge of tracking and who does what. And this just really helps to make the plan actionable and something that you are revisiting often and making sure that you're taking the time to make any updates that you need to make throughout the process of implementing your plan. And then here's the appendices with the strategic action plan template where you can input your specific information. And now I will turn it back to Amanda to go over our next challenge.
Okay, thank you, Leah. So we are going to move on to our second challenge, which we're calling the workforce woes. So this is a similar or a familiar situation for many departments. Your team is feeling overextended, and even though you know workforce development is important, it often gets pushed to the back burner. There's no consistent way to assess training needs, track professional growth, or plan for succession. So we're going to launch another poll to discuss. So as soon as it launches, please take a moment to respond. And the question reads, how confident do you feel in your department's current approach to workforce development? And it ranges from not at all confident to very confident. Okay, so we're seeing a range here, with the smallest amount being very confident and the largest amount being very confident. I'm surprised by these results. Really interesting, but also pretty normal too. The workforce development plan template that Leah's going to walk you through next can help with these workforce woes. Just like the strategic plan template, this tool is designed to meet you where you are and help you move forward in a structured, intentional way. So again, Leah's going to walk through what it includes and how it can strengthen both individual growth and organizational capacity.
Awesome, thanks. Yeah, I agree that these results are honestly making me really happy because it seems like things aren't as maybe bad as I thought they were, but luckily I think this template can still help if you're wanting a refresh to the plan or if you're just wanting a new framework to look at for workforce development. So to give you just some overall information on the workforce plan template, we did just update it to include guidance for reaccreditation. So now at this point, all of our templates and tools should include guidance for initial accreditation, pathways recognition, and reaccreditation. I am also going to do a quick walkthrough of this plan and how it can help you assess your training needs, make sure that you include information on continuing education requirements, and just bring some clarity to help your workforce development efforts all link together instead of being siloed across different departments or people. All right, so here is the workforce plan template. There's not as many optional sections here. It kind of just starts out with your department profile. This section outlines your mission, vision, values, and how workforce development connects to department goals, leadership, and partnerships. Then we go to workforce capacity, recruitment, and hiring, which assesses your current workforce and future needs, and also covers how to approach recruitment, diversity, and getting the right people in the right roles. Then we have employee training and development, which documents the core competencies, training needs, and development plans that you have. This includes continued education tracking, mentoring, and succession planning. And you can also note priorities from tools such as PHWins if you choose to utilize that tool. Then we have employee satisfaction and well-being, which is on workplace culture and includes how you assess staff satisfaction and well-being and how you're responding to that feedback. Then we get to your workforce plan objectives and strategies. These help turn the gaps that you discovered in the assessment that you did with staff into actionable strategies. This is where you will define who's responsible, you'll define timelines, and this just really keeps the plan actionable and connected to earlier sections. And then lastly, we have implementation and monitoring, which explains how progress will be tracked, when the plan is reviewed, and how it ties into your broader performance management and QI systems. And I will pass it back to Amanda for our third challenge.
Okay, thank you again, Leah. So here we are at our final challenge, accreditation coordination. This is one you might recognize as well. And your team is actively working towards pathways recognition, initial accreditation, or reaccreditation, but the process just feels kind of chaotic. Tasks are living in multiple spreadsheets, timelines shift without notice, and it's hard to keep track of who is doing what. So we're going to launch our final poll question, and this one is open-ended. So as it appears, please enter a response. And the question reads, what is one challenge your department has faced while coordinating accreditation efforts? We'll give it slightly more time too, just because it's open-ended and it might take a second for everyone to enter a response. Okay, we'll give it 10 more seconds. So if you haven't yet hit enter, please do so shortly. Okay. So this is my first time using the open-ended poll feature, and I am not able to read the results. I am wondering if Leah, are you able to see them?
No.
Okay, we do have our administrator on with us too, Lydia. Are you able to see any of the poll results or share them?
Yes, I am, and let me share my screen momentarily.
Thank you so much. I'll stop sharing. Thank you for your patience, everyone, while we work through this. I'm very interested to see what you said, what was shared. Oh, awesome. Okay, so it has understanding. Accreditation is the biggest one. Accreditation work, staff time, capacity, buy-in, another process, understanding, time along with other duties of the job, coordinating times to meet with SMEs, trouble finding certain versions of files, yes. Ownership, pushback of timelines, multiple competing priorities, that's a very common one. SMEs have very full schedules. Yes, wearing multiple hats is definitely a challenge, especially with already full plates. Triple documenting the process, establishing accountability. Yes, on the ground staff aren't don't understand, right? It's a lot to understand. It's very there's a lot that goes into the process, and making sure all of that is communicated effectively. Time is a big one. Yeah, where to store necessary documentation for everyone to access. Resource allocation is another one that we see in here often. Succession planning, especially with lower retention rates, is one we see kind of where the knowledge goes with the person who left. So succession planning can play a big role. Buy-in from leadership. Timeframes. Yes. No consistent lead person in charge. Yeah, having an accreditation coordinator to drive that kind of work or drive, be the driving force is important and helpful. General understanding and appreciation of program alignment with domains. The ever-changing political landscape, budgets, yes. And communication. Yeah, communication is a big one as well. Thank you, everyone, so much for sharing these. These are things that at least I have heard often, but we do have a new resource that Leah is going to walk through in just a moment. It's the Accreditation Project Management Tool. And this can help you really stay organized and aligned through your accreditation work with your team. Working on accreditation is definitely a marathon, and it has lots of moving parts. But if you do have the right kind of tools and systems in place, it can make the accreditation process run a lot smoother and easier. So with that, I'm going to hand it over to Leah to talk through this tool.
Awesome. Thank you. So I'm actually really excited to talk about this tool because from what we just saw in the poll, I think this tool will help to solve a lot of those issues. It definitely won't solve all of them. I need to work on a different tool to maybe try to solve all of those, but I think it does touch on quite a few. So just to give some background on the tool, it is based in Excel and it is free. So I know there are a few other project management systems that people sometimes use to help with the accreditation process. I know that those are not free, which I do think that they are helpful, but I really wanted to come up with something that was free, easily accessible, and something that you can just use as a starting place to help you manage the project of accreditation. I look at it as a big project. It takes a lot of time. You're putting in a lot of effort. There's a lot of moving pieces. And there wasn't currently really anything to help you manage the project. We do have our documentation trackers, and I would say that using the documentation tracker or whatever you use to organize your actual documentation should be used in tandem with this project management tool. This tool that I'm talking about is not meant to necessarily organize all of your different documentation and files, but instead it's meant to help to coordinate different tasks and delegate. So I will be doing a walkthrough of this tool. I do want to note that we have a user guide for this tool. It's only about 2 pages long, but I would definitely recommend reading that before you try to navigate the tool. It gives a lot of instructions. It explains how to use the tool. It goes tab by tab. Because we are a little bit ahead of time, so I might get to give a little bit more information on this tool than I was planning. But when I get done with this like really high level walkthrough, if you are still a bit like, okay, I'm not sure exactly how to use the tool, I would definitely recommend reviewing the user guide and just going to our website, taking a look at the tool. I think that will definitely help. So I'm going to go ahead and share my screen. Also, I am using a somewhat small screen for my second screen, so you can't see like the full length of the tool, but if you're using this on a monitor, you should be able to see the full tool. So the one thing I will note instruction-wise, each cell that includes a little red triangle in the top right-hand corner includes instructions on what you should do for the tab, what the tab is for. And then it also includes instructions for what you should insert into a blank cell. So if you open the tool and you're like, I have no idea what to do, just hover over the little red boxes and that will tell you what you would do there. There's also instructions at the top of each Excel sheet that tells you where to access the red triangles. So this is the first tab. It's a project overview tab. This gives a high-level summary of your accreditation project. You can use this space to document the project scope, team roles, key dates, and share this information with leadership. If you don't know where to start and you're a smaller health department and you just want to start somewhere, I would say just start by filling out this tab and then go from there. Next, we have a work breakdown structure for completing the readiness assessment. This would be something that would help you before you start your readiness assessment. You could fill out this tab with your core accreditation team. And this is just a structured checklist to help you assess how prepared your team is before jumping into the full accreditation process. It includes prompts across topics like leadership engagement, documentation systems, and staff capacity. And this is where you can also kind of get some ideas on some areas that you might need to prioritize or that might need some more attention as you are getting ready to do the readiness assessment. I've also included all of the different phases and tasks that you will need to do from just deciding that you want to pursue accreditation to actually submitting your readiness assessment. Again, I'm not going to go over every single section, but you can just hover over the instructions from the tab, from this little red triangle, and it will tell you how you use each section of the tab. Then we have a work breakdown structure for if you are pursuing pathways recognition or initial accreditation. And then we also have one if you are pursuing reaccreditation. So for example, if you're pursuing reaccreditation, I would just disregard or delete the initial accreditation and pathways tab and vice versa. These structures just help you break down the full accreditation process after you have applied and help to break it down into manageable pieces where you can assign responsible parties, assign due dates, and assign status. So here, if you want the tasks listed on exactly how you apply for initial accreditation or pathways, it's included. And then we have an opportunity for you to do a gap analysis or a SWOT analysis with your team, and then some tracking tables. Moving on to our sample action planner, I would say that this is best used if you have domain leads. This is where your domain lead could be in charge of this tab. And what I would do is duplicate this tab for other domains. Right now, it's only one for domain 1, but if you want one for each of the 10 domains, you can just duplicate the tab. And this is where you will really zoom in and build out some more detailed planning on gaps and specific areas that you want to work on within the 10 domains. So I think this is really helpful for any areas that need a bit more specific or focused attention. Then we have a Gantt chart template. This gives you a visual timeline to track your progress over time. You can easily see what's on track, what's coming up, and where delays might happen. And this is really helpful for reporting to leadership or keeping momentum during busy periods. And the way that you would utilize this, oh, I might not be loading all the way, but usually this is a full chart here. I'm not sure why it's cut off right now. But basically, these are just example tasks. What you would do is you would delete these and input your specific and unique tasks, and then input your start date and your days to complete. And then it will feed over into this Gantt chart table and show you a specific Gantt chart with your specific tasks and due dates. Then we have accreditation team meeting agendas. This is just a sample agenda meeting template to keep your team focused and organized. It's especially helpful if you have a cross-functional group that's working on accreditation or if staff rotate in and out of the meetings. And what I would do is I would just copy and paste this table for each meeting. And that way you have like a running list of agenda items and people can go back and see what you've talked about at previous meetings. And then we have a communication plan. I saw a few people say in the poll that communication was a hard part of accreditation. So hopefully this tab will help. This section really helps you identify different audiences, messaging goals, and strategies for both internal and external communication, and really helps to reinforce that accreditation is not only a technical task, but also a process that requires really clear communication and stakeholder engagement. So in this tab, it offers a few example audiences and groups that you would need to communicate with throughout the accreditation process. It gives you a purpose of why you would want to communicate. It gives you some example messages that you would want to communicate with them. And then you have method, frequency, responsible person, and notes. So you could definitely keep all of these, you could change them, you could add to it. Really, this entire tool is meant to be super adaptable and flexible to your accreditation process. And at first glance, it might seem a bit overwhelming, but that is because we really tried to include everything that we could think of that would be helpful for you to help manage your process. However, you definitely do not need to use every single tab or every section in every tab. You can kind of pick and choose what is most helpful to your accreditation process. And then lastly, I do want to talk a little bit about how this tool supports quality improvement and performance management. It helps support these two different topics by encouraging consistent tracking, reflection, and adaptation. It allows your team to regularly assess progress, identify barriers, and adjust strategies, just like you would with any QI project. It also links your accreditation work to broader departmental planning and improvement goals. So while this tool was specifically created for the accreditation process, I think there are definitely a lot of different aspects of the tool that you could use for any project that you're working on. So I think that even if you are not pursuing accreditation at this time, you could still use this framework to help you with other projects you're working on or to help you prepare for accreditation. All right, now that we've done the 3 walkthroughs, we can go ahead and share the PowerPoint slides again. All right, thank you, Amanda. So now that we've gone through all of these different tools, I really just want to take a step back and try to connect the dots here. Each of the tools that we've explored today are rooted in a simple but powerful idea. When you plan, reflect, and adapt, you build a stronger and more resilient public health department, or state health department, or territorial, or tribal. Don't want to only stick with the public. The strategic plan gives you a clear roadmap of where you're going and how you'll get there. The workforce development plan ensures you have the people and skills in place to continually grow and progress. And the accreditation project management tool helps you stay organized and accountable, turning plans into progress and moving your accreditation efforts forward. Most importantly, these tools were not meant just to meet requirements or just to check a box, but they were designed to help you implement, coordinate, and improve in real time. Used together, they can reinforce a culture of performance and quality improvement where your team feels like they have the clarity, collaboration, and flexibility to adapt when needed. We can go ahead and go to the next slide. Awesome, thank you. So I also want to make sure that you know that the resources we went over today are just a few of the resources that are available. We have developed several other templates designed to make your work easier and more aligned, especially if you are in a small or under-resourced department. We do have a quality improvement plan template, which helps you track and reflect on improvement efforts in a structured way. We came out with a non-emergency communication procedures template in February of this year, which helps departments proactively define how messages are developed, reviewed, and shared. And then we will pretty soon be releasing a risk communication template, which offers a framework for timely and accurate public messages during emergencies or fast-moving situations.
Okay, and with that, we would like to ask you to please take a moment to reflect on what stood out most to you today. Think about the tools that we covered that Leah shared, and think about which one could help your team take the next step. We'd love to hear your thoughts on these questions in the Q&A box. That could be a place that you can drop them. And also please drop in the Q&A box if there's any other type of support or resource that you think could be helpful. We'd love to hear from you in that regard as well. And of course, if you have any questions about what we covered so far today, now is a great time to drop those into the Q&A box as well. Leah and I are going to do our very best to get to as many as we can. And I do see a couple of them in the chat. So one of them is, where can we find the project management tool? And they were just dropped in the chat, all of the templates and tools that Leah was talking about, as well as the additional ones that were just shared as well, including that QI plan template. So then, thank you. I see the questions rolling in and also your suggestions and the tools that you liked most or reflected upon today. So thank you. So we have a question that says, how are competencies typically divided upon for the workforce development plan? And is there a specified number of competencies that are required to be included? And I'll pass that one to Leah.
Yeah, so it would depend on which type of assessment your staff is taking. But after they take an assessment, one specific one that I mentioned today was PHWINS. There's also a lot of other ones you could take. Then you could see by the results of that assessment which of the core competencies were maybe scored the lowest. And then from that, you could make a plan to try to address those competencies that were scored a bit lower and try to gain a bit more knowledge on those competencies. Sorry, I'm having a hard time saying that for some reason. And then also within the PHAB standards and measures, there are a few specific core competencies that it does call out. I believe one of them is health equity. Off the top of my head, I can't remember what the other ones are, but if you go to domain 8 and review that, it gives a few examples of which ones that it wants you to specifically see where your staff is at. So hopefully that answers your question. If not, let me know and I can try to look into it a bit more.
So I see a couple of comments regarding the strategic plan template and the links not working in the chat. So sorry about that. We are going to be, we can, I believe, send a follow-up email with the links, but most of the tools, right? Is it all of them, Leah, that can be found on the link that you shared? Perfect.
Yes. So yeah, sorry, I don't know what the matter is with the individual links, but if you go to the link that I put in, it's just our website. You go to products and services, and then there's a drop-down menu that says complementary tools, and you can access all of the resources there.
Perfect. So please, if you haven't checked out that link that Leah dropped in the chat, please do so, and hopefully the links all work there. But if they don't, please let us know as well. So I see lots of love for the project management tool. Absolutely love the project management tool. Happy to see reaccreditation included. Motivated to get started on this right away. Awesome to hear that, Laurie. Thank you so much. Accreditation toolkit, all of the templates, including the project management one. Thank you. You are most welcome. Thank you for sharing. Looking forward to the workforce development template as you're updating your strategic plan as well. Awesome. All of them already started working on the project management template. That's great, Sophia. Thank you for sharing.
I am seeing one question about if the tools can be used for reaccreditation preparation. Definitely. So all of the tools that I shared today, the strategic plan template and the workforce development plan template, they all have guidance for reaccreditation. And then the project management tool has a specific tab for reaccreditation as well. And also just want to say that I'm really happy that folks are saying that the project management tool is going to be helpful for them. I do want to let you all know that this is just the first iteration of the tool. So if you use it and you have feedback, things that could be adjusted, or different tabs that you would like included, please email us and let us know, because we would love to continue to build this tool out and make it as helpful as possible. The other thing I will say is all of this tool, all of the different cells that you are supposed to type in, those are unlocked and you can easily type in whatever you need to type in. The actual tables and subtitles are locked at the moment. If for some reason you really want to change some of the subtitles or tables, then go ahead and email me and I can help you fix that. We just didn't want to have it unlocked for everyone. So again, let me know if any questions or feedback comes up with the tool, and we would love to address it.
Yeah, I definitely want to hear from you. Awesome. All right. Any other questions before we wrap up for today? We definitely have time for them, so please let us know. I'll give us a moment or two. Also, it happens to me all the time, is as soon as we hang up today and you're like, I wish I asked this. Please reach out to us at phabta@phabboard.org. If you have any questions that come to you later, we definitely want to hear them and are happy to help in any way we can. All right. Seeing nothing, Leah, making sure that you don't see any additional questions that I might be missing.
No, I
All
think
right.
we're good. Yeah.
Moving us forward then. Thanks, everyone. All right, so as we wrap up, I wanted to shout out our new PHAB products and services. Leah touched on this earlier by sharing this link. But PHAB has a variety of resources and offerings that can support the use of the templates and tools that we mentioned today. All of PHAB's consulting services and our trainings and workshops can be purchased as is, or they can be really customized to meet the needs of your department. Listed on the slide here are just a few examples, and we invite you to visit our website for more information. And if you have any questions about them, you can reach out to phabta@phabboard.org as well. Finally, we invite you to connect with us on Instagram and Blue Sky. It's @phabboard. And on LinkedIn, Facebook, and YouTube, we're under Public Health Accreditation Board. And our website is phabboard.org. Our communications team would be extra excited if you gave us a follow and connected. They are constantly putting out content and updates and notifying everyone of resources as they drop. So definitely check that out if you haven't done so already. And then Lydia just dropped in the chat a brief evaluation survey. If you have time, we would really appreciate you filling that out. It'll give us a chance to see what you liked and what we could have done to improve the session. And finally, we just wanted to say thank you. Thank you very much for spending time with us today and for the work you do every day to strengthen public health. And with that, we will end today's session, and I hope you all have a wonderful rest of your week. Thanks, everyone.